Diagnosis. Diagnosis uses clinical judgment that's based on the information that is obtained through your assessment. A nursing diagnosis is selected on the basis of that assessment. The nursing diagnosis is individualized by adding related to and as evidenced by. For example, risk for constipation related to narcotic use as evidenced by hypoactive bowel sounds. That is an individualized nursing diagnosis. There's 3 different types of nursing diagnosis. We have actual, which is sufficient assessment data to establish the nursing diagnosis. We have risk, which are risk factors assessed to show the need for planning preventative care. For example, risk for constipation or risk for dehydration. And then we have health promotion, which is a readiness for improvement of health status. Components of the nursing diagnosis, we've got the diagnostic level. The nursing diagnosis, as approved by NANDA, describes characteristics of human response. Related factors are identified from assessment data and they're the reason for the diagnosis. Make sure that you do not use medical diagnoses. In other words, alteration in comfort related to appendectomy is a medical diagnosis. You cannot use appendectomy. And consider the PES format: problem, etiology, and symptoms. In other words, impaired skin integrity would be the problem. Related to decreased ambulation and mobility is the etiology or the related to factor, as evidenced by weakness to the right arm and leg, which would be the symptom. So you have the problem, the etiology, and then the symptom. Concept mapping takes the overall problem. It can be the medical diagnosis in this situation, along with the assessments that you're focusing on, and it determines most important nursing diagnoses with significant information regarding that diagnosis. Like, why did you choose this diagnosis? For example, impaired comfort, moans with movement, states pain is 8 on a 1 to 10 scale, frequent requests for pain medication, and the interventions for the diagnosis. It might be easier using a concept map to actually visualize what's going on with the client. There are several examples of concept mapping within your text. Sources of diagnostic error can come about through interpretation and analysis of data. Make sure that your data bank is accurate. Data clustering occurs when data is clustered prematurely, incorrectly, or is possibly omitted. A diagnostic statement should use NANDA terminology. Documentation and informatics puts the highest priority nursing diagnosis first, and clients often are going to have more than one nursing diagnoses. So the highest priority diagnosis would be listed first. Priority, once again, is determined by severity. Is it life-threatening? Does it affect basic needs? As the interventions for nursing diagnosis have some standardized basis, it will allow for continuity from one nurse to another.